Welcome to the deep dive. Today, we're taking a closer look at a really critical, often kind of underestimated part of your health. We're talking about the intricate world of bile, the gallbladder, and the whole biliary tract. We got a great stack of sources here, and we're going to cut through the jargon, make this complex system clear and memorable for you. Our mission to understand how these parts work, what goes wrong, and really why it all matters so much for your overall well-being.
Exactly. And, getting these foundational concepts is just so key to grasping broader health issues. It really helps connect the dots in pathophysiology, seeing how something seemingly small can ripple through the whole body.
Okay, so let's start right at the beginning then. What exactly is bile and why is it so important? Our sources mention it's like a super-powered detergent.
Huh. That's actually a pretty good way to put it. Bile is this greenish-yellow fluid made by your liver. And it's not simple stuff. It's a mix of water, cholesterol, bile salts, bilirubin, that's what gives it the color, phospholipids, electrolytes, a real cocktail. And its main job, that detergent action, it emulsifies fats in your small intestine.
Emulsifies. So you mean like how dish soap breaks down grease when you're washing up?
Precisely that. Imagine a big blob of fat. Bile salts surround it, break it into tiny, tiny droplets. This massively increases the surface area.
Okay, and why is that important? Just helps it move along?
Well, it's more than that.
Yeah.
That huge surface area means digestive enzymes can attack the fat way more effectively. It dramatically improves digestion and, crucially, the absorption of fat-soluble vitamins. A, D, E, and K.
Ah, right. So if bile isn't flowing right.
Exactly. If your body isn't making or releasing bile properly, you're not just looking at, say, digestive upset. You could be heading towards real vitamin deficiencies. That impacts everything. Vision, bones, clotting. It's fundamental.
Okay, that really underlines its importance. So what happens when this essential flow gets interrupted? This brings us to the first big disorder, cholestasis.
Right, cholestasis. Simply put, it's the impaired flow of bile.
Impaired flow, like a blockage?
Yeah, think of it like a blocked drain in the system. The causes generally fall into two buckets. Intrahepatic, meaning the problem's actually inside the liver itself, or extrahepatic, where the issue is outside the liver, usually in the bigger bile ducts.
Okay, inside or outside the liver, can you give us some examples? What could go wrong inside?
Sure. Intrahepatic causes. Well, you could have damage to the liver cells, the hepatocytes, so they just fail to secrete bile properly. This can happen in severe liver disease, like cirrhosis maybe from hepatitis, alcohol, autoimmune issues. Or you could have cholangitis, which is inflammation of the tiny bile ducts within the liver. Some autoimmune conditions cause that, leading towards biliary cirrhosis.
Got it. And the extrahepatic causes? The blockages outside the liver, what are the usual suspects there?
Outside the liver, the classic one is gallstones that have moved into the common bile duct. We call that cholelithiasis.
Ah, so a stone on the move.
Exactly. But it's not just stones. Tumors could do it too, especially ones near the ampulla levator, that junction where bile and pancreatic ducts meet the intestine, or tumors in the head of the pancreas pressing on the duct. And there's also a condition called primary sclerosing cholangitis, which causes scarring and narrowing of those big ducts. We can maybe touch on that more later.
Okay, so bile isn't flowing, it's backing up. What does that do to the body? What are the consequences?
Well, when bile backs up, those bile salts, normally helpful, start to accumulate and become toxic. They directly damage the liver cells and the lining of the bile ducts.
Damage them? How does that show up?
You'd see or feel symptoms like intense itching, that's pruritus and jaundice, or icterus, where the skin and eyes turn yellow because bilirubin builds up.
So the bile itself becomes harmful?
Yes, when it's stuck. This damage to the biliary lining triggers inflammation. Over time, that leads to fibrosis scarring, basically. This scarring causes strictures, narrowing the ducts even more, making the obstruction worse. It's a vicious cycle.
Wow. And the liver cells themselves?
The injury to hepatocytes can progress. Chronic inflammation can eventually lead to biliary cirrhosis, that's severe, irreversible liver scarring.
And what about digestion, the reason we need bile in the first place?
Big impact there. You get significant fat malabsorption. This leads to fatty stools, steatorrhea, and like we mentioned, those ongoing deficiencies in fat-soluble vitamins A, D, E, and K.
Anything else?
Yes, a couple more things. We often see hypercholesterolemia because the body's normal route for getting rid of cholesterol via bile is blocked. And importantly, the stagnant bile is a breeding ground for bacteria. The risk of ascending bacterial infection shooting up into the bile ducts increases dramatically.
So what starts as a flow problem quickly becomes toxic damage, nutritional deficiencies, and infection risk. Grim.
It really highlights how crucial that free flow of bile is.
You mentioned cholestasis, stones in the bile duct, as a major cause. Let's talk more about gallstones, cholestasis. They're super common, right? But what are they actually made of?
Oh, incredibly common. Many people have them and don't even know. They're solid lumps formed from bile components, usually in the gallbladder, but sometimes in the ducts. Why do they form? It's usually down to an imbalance in the bile's ingredients.
An imbalance, like too much of something.
Exactly. Too much cholesterol or too much bilirubin, or conversely, not enough bile salts to keep everything dissolved. That decrease in bile salts can happen, for instance, if part of the small intestine, the ileum, is removed in ileal resection. That disrupts the enterohepatic circulation, the body's system for recycling bile salts.
Interesting. Anything else?
Yeah, increased mucin production in the gallbladder can play a role. Or if the gallbladder itself just isn't contracting well, isn't emptying properly, decreased motility.
Okay. Our sources mention two main types. About 80% are cholesterol stones.
That's right. They're typically yellowish, could be one big one or lots of smaller ones. And there's a classic demographic profile, often cited, the female fat 40 idea. They are more common in obese, middle-aged women.
Why is that?
Things like obesity, rapid weight loss, even high estrogen levels can increase the amount of cholesterol secreted into the bile, upsetting that balance we talked about. Or sometimes it's due to having lower bile salts.
Makes sense. And the other 20%, pigment stones.
Yep, pigment stones.
Yeah.
Made mostly of bilirubin. They look black or brown. The black stones you often see in conditions with chronic hemolysis like sickle cell anemia, where lots of red blood cells are breaking down, releasing excess bilirubin. Brown stones are more frequently associated with biliary infections and inflammation.
And location matters, right? You said stones in the gallbladder versus the common bile duct?
Absolutely. Cholestasis means stones in the gallbladder, often asymptomatic. But cholestasis, stones in the common bile duct, it's much more likely to cause problems, like the cholestasis we discussed. Big difference.
So many people have stones without symptoms, but when they do cause issues, what does that actually feel like?
The classic presentation is pain in the right upper quadrant of the abdomen, often triggered or worsened by fatty meals.
What kind of pain?
It can be a constant aching pressure-like pain, which is often from the gallbladder being distended, or it can be that intense cramping wave-like pain called biliary colic. That usually happens when a stone is actually moving or temporarily blocking a duct.
Ouch. Anything else?
Nausea and vomiting are very common too.
It's quite something that these little stones can lead to such serious complications. What are the major risks if things go wrong?
The risks are significant. A stone can put pressure on the gallbladder wall, cutting off blood supply that's ischemia, that can lead to tissue death, necrosis, or even gangrene. And in the worst case, the gallbladder can actually rupture, causing peritonitis, a dangerous infection of the abdominal cavity.
That sounds terrifying. What about stones moving into the ducts?
If a stone migrates into the bile ducts and causes a blockage and infection, that's cholangitis. This can rapidly become severe, leading to biliary sepsis infection, spreading into the bloodstream, or even abscesses forming in the liver.
And long term?
There's a rare but serious link between chronic irritation from gallstones and the development of gallbladder carcinoma, cancer.
Okay, so stones can cause blockages, pain, and these severe complications. This leads naturally to cholestasis, right? The inflammation of the gallbladder itself.
Exactly. Cholestasis is most often directly linked to gallstones. About 95% of cases are acute calculus cholestasis.
Calculus meaning stone-related.
Right. A stone gets stuck, usually in the neck of the gallbladder or the cystic duct, the tube leading out of the gallbladder. Bile can't get out, so it builds up, distending the gallbladder. This stretches the wall, compresses blood vessels in the wall, causing ischemia. That leads to inflammation, and often bacteria move in, causing infection.
So the stone itself, just by blocking the exit, triggers this whole cascade.
Precisely. Then there's acute calculus cholestasis, no stones involved.
Really? How does that happen?
It's less common, usually seen in very sick patients, maybe in the ICU.
Yeah.
It's often part of a larger picture of multi-organ problems where the gallbladder just becomes ischemic and inflamed due to the overall critical illness.
And then there's chronic?
Yes, chronic cholestasis. This is usually the result of repeated minor episodes of obstruction or inflammation, perhaps from stones intermittently blocking things. Over time, the gallbladder wall becomes thickened, scarred, fibrotic, and it doesn't function as well. Symptoms are often milder. Maybe some nagging RUQ discomfort, nausea, especially after fatty meals.
What would an inflamed gallbladder look like? You mentioned scarring in the chronic form. What about acutely? And our sources mention something called a porcelain gallbladder.
Morphologically, In acute cholecystitis, the gallbladder is often enlarged, tense, red, inflamed. The wall is thickened. The inner lining, the mucosa, might show erosions, ulcers, even areas of necrosis. Sometimes you see pseudomembranes, these sort of sticky inflammatory layers. And porcelain gallbladder, that's an interesting one. It's a late stage of chronic cholecystitis, usually with long-term obstruction. The trapped bile gets resorbed, leaving behind clear mucus. It's called hydrops. Then calcium salts get deposited in the scarred gallbladder wall. It becomes brittle, rigid, calcified, looking like porcelain on imaging. It's also associated with an increased risk of gallbladder cancer.
Fascinating in a medical sense. So if someone comes in with acute cholecystitis, what's the general approach?
Standard treatment usually involves getting the inflammation under control first. So IV fluids, pain management, antibiotics to treat or prevent infection. Often patients are kept from eating initially, maybe needing parenteral nutrition. But the definitive treatment, once the patient is stable, is surgery to remove the gallbladder or cholecystectomy, often done laparoscopically now.
Okay, so we've covered cholestasis, stones, and gallbladder inflammation. But the biliary tract is more complex. Our sources also point to other important diseases, including autoimmune ones.
Yes, absolutely. Beyond stones, there are these chronic conditions where the body's own immune system causes problems. A key one is primary biliary cholangitis, or PBC. This is an autoimmune disease where the immune system attacks and destroys the small bile ducts inside the liver.
Inside the liver, okay.
Yes, it leads to cholestasis, inflammation, scarring, and eventually can progress to cirrhosis. It mainly affects middle-aged women, and a big clue is the presence of anti-mitochondrial antibodies, AMA, in the blood.
And the other main autoimmune one?
That would be primary sclerosing cholangitis, or PSC. This one is different because it causes inflammation and fibrosis. That's scarring again in both the intrahepatic and the extrahepatic bile ducts. The larger ducts outside the liver get involved too.
And that's linked to another condition, right?
Yes, there's a very strong association between PSC and ulcerative colitis, an inflammatory bowel disease. Many people with PSC also have UC. Like PBC, PSC is progressive. The scarring leads to strictures, blockages, cholestasis, recurrent infections, and often cirrhosis. Both PBC and PSC can eventually lead to end-stage liver disease requiring a transplant.
So these show the immune system itself attacking the bile ducts. What about issues present from birth?
Right, the sources mentioned biliary atresia. This is a serious condition in newborns where the bile ducts outside the liver are blocked or absent. It's a major cause of neonatal cholestasis and jaundice in infants and needs early surgical intervention.
And infections. We mentioned bacteria getting in with cholestasis. Is there a specific name for that infection?
Yes, when you get an acute bacterial infection of the biliary tree, often because of stasis or obstruction, it's called ascending cholangitis.
Ascending, because the bacteria come up from.
Exactly. They typically ascend from the duodenum, the first part of the small intestine. Common bacteria are ones normally found in the gut, like E. coli, Klebsiella, and Enterococcus. They thrive when bile isn't flowing well.
What are the key signs of ascending cholangitis?
There's a classic clinical picture called Charcot triad. It consists of fever, often with chills, jaundice, and right upper quadrant abdominal pain.
Fever, jaundice, RUQ pain, Charcot triad.
Correct. If it gets really severe, you can add confusion and low blood pressure, shock. That's called Reynolds pentad. But Charcot triad is the core. It's a medical emergency.
Can anything trigger it besides, say, a stone blocking things?
It's usually related to obstruction, but sometimes procedures that involve instrumenting the bile ducts, like ERCP, that endoscopic procedure we mentioned, can potentially introduce bacteria or cause temporary swelling that leads to stasis and infection, although that's a known risk managed carefully.
And treatment.
Prompt treatment with broad-spectrum antibiotics is crucial, along with addressing the underlying obstruction if possible, often needing urgent drainage of the bile ducts.
Okay, one last area. Chronic inflammation and irritation. Sadly, sometimes that leads to cancer, right?
Unfortunately, yes. Chronic inflammation is a risk factor for malignancy in many parts of the body, and the biliary system is no exception. We mentioned gallbladder carcinoma, which often develops in the setting of chronic cholecystitis and gallstones. It's relatively uncommon, but often diagnosed late. And then there's cancer of the bile ducts themselves, cholangiocarcinoma. This can arise anywhere along the biliary tree. A specific type that occurs right where the main bile ducts branch off from the liver at the hepatic hilum is called a Klatskin tumor. These are particularly difficult to treat because of their location.
Wow, okay. We've really covered a lot of ground. You've just taken us on a deep dive into this critical and honestly pretty complex system, from understanding what bile does that essential detergent action to seeing what happens when flow stops in cholestasis, the whole cascade of problems. We looked at gallstones, how they form, the different types, the pain they cause, and those really severe complications. Then cholecystitis, the inflamed gallbladder, calculus and acalculus, and that fascinating porcelain gallbladder, plus the autoimmune attacks in PBC and PSC, the dangerous infection of ascending cholangitis, and finally, the risk of tumors. It really shows how interconnected it all is, doesn't it? How one problem, like a stone or poor flow, can trigger so many others.
Absolutely. It's a perfect example of how integrated our body systems are. And it makes you think, considering the huge ripple effect that something as seemingly simple as bile flow has, affecting the liver, digestion, nutrition, infection risk, even cancer risk. It really poses an interesting question. What other seemingly minor or background body functions might actually have similarly profound and far-reaching implications for our overall health, implications that maybe we don't always fully appreciate?
That is a fantastic thought to leave everyone with, something to definitely mull over. Thank you so much for guiding us through that. And thank you for joining us on this deep dive. Keep exploring the amazing complexities of the human body. There's always more to learn.